I want to sit down and explain something today that frankly isn't getting enough attention, even though it's bearing down on millions of American seniors right now. As we head into the summer of 2026, there are three separate regulatory changes that either take effect or tighten significantly this July. Three different vectors where your income or benefits can quietly decrease without advance notice, and not because you made an error, it's because the system changed, and almost nobody bothered to explain it before it arrived. Most people won't see this coming until a letter shows up or they notice the deposit was smaller than expected. I want to flip that script today. Instead of hunting for money you didn't know you could get, I'm going to warn you about money you could lose if you don't take action right now. One of these changes can carve 15% out of your Social Security check every month with no warning. Another can eliminate food assistance for people who've relied on it for years because a single birthday crossed a new threshold. And the third is a tidal wave of new paperwork attached to your health coverage. And yes, even people on Medicare get caught in the paperwork trap. Stick with me because I'm going to break down all three changes, the exact numbers affected, who gets hit hardest, and what you actually need to do before July ends to protect yourself. If this kind of real financial information is useful, subscribe right now and turn on notifications. I cover exactly this kind of thing every single week, the shifts that actually affect your paycheck, and the protection you already qualify for but nobody told you about. Let's get into it. Why isn't anyone talking about this? If this is real, you'd think the evening news would lead with it, right? The answer is always the same. These changes trace back to a major federal law passed in the summer of 2025, and the various agencies responsible have been releasing the actual implementation details in pieces ever since, so mostly buried in thick guidance documents that never make it past the government website. Nobody's job is to call you personally and walk you through how it affects your specific situation. That means it lands on you to find out before the notice arrives. Let's handle that today. Change number 1. Student loan collections restart on Social Security. But there's a shield. Here's the first one, and I'd call it the sneakiest because it taps directly into a check you're already counting on. If you're 62 or older, still carrying federal student loan debt, and you've fallen behind on payments, the federal collection machinery is switching back on starting July 1st, 2026. For years, through the pandemic and beyond, the government paused collections against Social Security benefits. That pause ends this July. The Department of Education can restart the Treasury offset program on Social Security payments for people who are delinquent on federal student loans. And yes, that includes retirement, survivor, and disability benefits. The key number to know, by law, the maximum withholding is capped at 15% of your monthly benefit, with a floor of $750. They cannot reduce your check below $750 a month, no matter how much debt is outstanding. But above that line, 15% disappears every single month until the debt is resolved. Who gets caught here? More people than you'd expect. The number of Social Security beneficiaries age 62 and older carrying federal student debt has climbed significantly, and federal data shows hundreds of thousands of older borrowers are behind on payments. Some of it is their own debt from going back to school later in life. A lot of it is Parent Plus loans they co-signed decades ago to help a child through college, debt that's still tied to their name today. Here's the part that should calm you down rather than add stress. If you qualify for a financial hardship exemption, meaning the garnishment would leave you unable to pay for basic living expenses, you can stop this before it touches your account. And here's the stunning part. Research shows that roughly 8 in 10 people facing this garnishment would likely qualify for a hardship exemption if they simply applied. Yet fewer than 1 in 10 actually do. It's not that they're ineligible, they just don't know the door exists. Let me give you a concrete example. I had a case involving a retired electrician. I'll call him James, age 72. He'd co-signed a Parent Plus loan years ago, so his son could finish his degree. His son is doing well now, but the loan never got fully paid off. James got a threatening notice about a 15% cut to a Social Security check that was already tight. One call to his loan servicer, 30 minutes of paperwork describing his financial hardship, and that garnishment never happened. Same debt, same James Ice, completely different outcome because he finally knew the exemption was there. So what's your move? If you're carrying federal student debt and you're behind, don't wait for the letter. Contact your loan servicer directly today and ask about a financial hardship exemption or an income-driven repayment plan. Get whatever agreement you're offered in writing. And if a letter has already arrived, you typically have time to respond before any withholding starts. So move fast. One warning I have to add: the moment collections restart, the predatory calls spike. Someone calls claiming to be from the Department of Education or a firm calling itself Student Loan Relief Services, offering to halt your garnishment today if you'll just pay a fee or hand over your bank information. Hang up. You never pay a private company to file for a hardship exemption or get into an income-driven plan. That's handled directly through your servicer or at studentaid.gov, and it's always free. Change number 2. SNAP work requirements just got stricter, and 1 million seniors are at risk now for the second shift, and this one hits your grocery bill directly. If you're somewhere between 55 and 64 and SNAP food stamps are helping you cover groceries, you need to pay close attention to this. For a long time, the work requirement attached to SNAP, the requirement to document 80 hours a month of work, training, or volunteering, topped out at age 54. Turn 55, and you were automatically exempted. That safety net just got yanked up. The age limit jumped to 64. That means people in their late 50s and early 60s, people who'd been exempt their whole adult lives because of their age, are now required to document work activity or risk losing benefits after 3 months. On top of that, a whole category of exemptions that used to be automatic got narrowed or eliminated. Veterans, people experiencing homelessness, and some caregivers are now in tighter spots. Policy forecasts predict this could push more than 1 million older adults into losing food assistance they've depended on for years. That's not abstract. That's the groceries that were going on the table. I want to introduce you to someone. Let's call her Patricia, 62 years old. She lost her job in retail about a year ago and has been getting by on savings and a small SNAP benefit while looking for work in a tough job market. A year ago, her age alone would have exempted her from any work requirement. Today, she got a notice saying she needs to document 80 hours a month of activity or her benefits expire in 3 months. Patricia didn't do anything wrong. The rule changed and suddenly she's on the hook. What should you do if you're 55 to 64 and getting SNAP? First, don't ignore any letter from your state benefits office. Call them directly and ask which exemptions still apply to you. Disability still gets you off the hook, and that includes mental health conditions, not just physical ones. Caring for a child under 14 still counts. Documented medical conditions still work. Each state handles the paperwork differently, so find out what yours needs. If you do have to log work hours, community service and approved training count just as much as paid employment. And if you're over 60 with medical bills running more than $35 a month, make sure your caseworker is applying the excess medical deduction, because a lot of eligible seniors never mention it and end up with a smaller benefit than they're entitled to. Change number 3. Medicaid paperwork overhaul, and Medicare doesn't always protect you. And now the third change, which I think by the end of 2026 ends up affecting more households than people realize, even though it's marketed as something that doesn't involve seniors. This is the Medicaid paperwork restructuring, with a major enforcement deadline of July 31st, 2026. Here's what everyone misunderstands. If you're 65 or older or already on Medicare, you're generally excused from the new work requirement itself. I want to be clear about that, so I'm not scaring you needlessly. But here's where the real problem creeps in. States are required to send outreach letters to everyone potentially affected between now and the end of August 2026. And for a large share of people, the redetermination paperwork, the forms that decide whether your coverage keeps going, is getting shorter, arriving more frequently, and stricter. At the same time, the federal definition of who qualifies as too disabled to work is getting tightened under new guidance that just came out. In practical terms, a massive flood of confusing notices is hitting millions of households all at once, and this includes homes where an aging parent is on Medicaid and Medicare together, or where a spouse aged 55 to 64 is on Medicaid in the same household as someone who's exempt. When paperwork arrives at this scale, with this much confusion built in, history shows us what happens. Millions lose coverage through administrative failure, not because they were ineligible, but because a form got delivered late, or a notice looked like junk mail and got tossed, or the deadline came and went before anyone noticed. Here's what you need to do. If a Medicaid letter shows up at your house this summer, don't assume it's not relevant just because you're 65 or on Medicare. Open it, read exactly what it's asking, and if anything is unclear, and a lot of it will be, call your state Medicaid office or your local SHIP program, State Health Insurance Assistance Program, and have them walk you through it at no cost. Update your mailing address and phone number with them right now if it's been a while, because the letter you never receive is a deadline you can never meet. What this looks like altogether. Let me tie all three together so you see the complete picture. The student loan piece. 15% of your Social Security can vanish monthly, though there's a $750 floor, and most people would qualify for a hardship exemption if they asked. The SNAP piece. An estimated 1 million plus older adults are now at risk of losing food benefits because a birthday crossed a new threshold that used to protect them. The Medicaid piece. Millions could lose coverage not because they're ineligible, but because a form arrived confused or got overlooked in a sea of paperwork. Your action plan. Here's what I need you to do this week. None of these three changes are unstoppable. Each has a documented exemption, a hardship option, or a simple phone call that can protect you, as long as you find out before the deadline passes. First, if you're carrying federal student debt and falling behind, call your loan servicer today and ask about a financial hardship exemption before July 1st hits. Get it in writing. Second, if you or anyone in your household is 55 to 64 and receives SNAP, call your state benefits office and ask exactly which exemptions still apply to you. Third, if a Medicaid letter shows up this summer, whether it's addressed to you or to someone else in your home, open it that day and call your state office or SHIP program to get help understanding it. And one last thing, legitimate government offices never call you out of nowhere demanding your bank account or social security number to fix these issues on the spot. You always place the call yourself using the number on your official paperwork or your state's website. Never the other way around. After today, and knowing in time is the difference between protected and blindsided.